Dr. Jyl is my veterinarian, and she is based out of Folsom, California. She's integrated veterinarian that has amazing plethora of modalities, you guys. It's crazy. It's so much fun to go to her clinic. She works on all sorts of animals, not just dogs and cats. So you might see a chicken or a pig lying on the table or something else, maybe a llama. I've never actually seen her work on a llama, but I know she has lots of creatures. And you even did some oceanography type stuff, right, Dr. Jyl?
I have, yeah, actually. I've done some
Yeah.
aquarium work. Yes.
So it's amazing that you have all this diversity and a passion for the holistic on top of that. So this is so much fun. Thank you for taking the day to go live with us. I know you're very, very busy, and I'm just grateful that you are here today. So today we're going to talk about some cancer-free canine cases that Dr. Jyl has worked on, and she throws the kitchen sink at them, you guys. It's fun to hear all the different modalities that she uses, because some of them I've never really even heard of. So this will be exciting. Thank you for coming. Dr. Jyl, is there anything else you want to tell us about you or your practice?
No, thanks for having me. First of all, you also as well are a pretty amazing individual I watched you do some work last week with the horses, and I was just like in awe of the ability to communicate and really understand them. And I was really impressed watching you and Michelle go to work. It
was really fun, and I have to say that chestnut gelding of mine is moving better than I've seen
awesome
in years. So I have to retreat him, and I want you to hold my hand on that, because I'm like, well, I don't want to lose this. But anyway, we got to get back to dogs today. And so
dogs, cats. Well, I mean, everything gets cancer, Poppy, right? I mean, there isn't really any kind of species, and I see it all: rats, hedgehogs, mice. I mean, if people they've really come to fruition with their pets, right? It doesn't really matter what it is. If they have an attachment, I had a guinea pig yesterday that I did surgery on. It had a giant mass on its head, right? And so my staff's like, hey, we can't believe this lady's actually spending money on this guinea pig. And I'm like, but she's an autistic lady. It is her baby. She loves it. And, that attachment or that bond is very important. So I think people are looking for answers that are outside of the box, especially on some of these little exotic animals where we don't really have a lot of answers yet. And I'm kind of the mind that, if it has a bad prognosis, why not try things that aren't going to hurt it, that only in the direction can help it, right?
Right. No, I totally feel like adversity is opportunity.
Absolutely.
And so sometimes when it's darkest, we come to our greatest discoveries. And you actually have a case on this.
Yeah, so I adopted a boxer. I have a boxer fetish, and I had adopted a boxer from LA years ago now. She's passed, but it was such an interesting case to me. And she came to me. She looked like she had been burned in a fire. She had severe Demodex, had been a bait dog, just skeletal. And we brought her around. I had her for several years. She was just a very fearful dog, was petrified of anybody and everybody other than people, ironically. And we had 5 dogs in the house, and she was fearful. She would want to basically chew their faces off. And, when she passed, she was friends with like 6 other dogs, and they were buddies, and they all loved her. But what was interesting is about 5 years into me owning her, we actually cleared up her Demodex with all supplements, bathing and nutrition, which, a lot of people want to dump all that toxic chemical on them. And she was head to toe. I mean, there was not a spot on her body that had any hair. So, and I've seen that happen before where they dump the toxic chemicals on, and it puts them into a frenzy. It puts them into almost an acute histamine reaction where they can actually die from that, because the overload of Demodex comes out and dies, and it's toxic. So this dog was never really a well dog, but we got her to a point where she was almost pretty normal. She grew all of her hair back. Super playful dog, super happy to be in a good home. And then, one day I took one look at her and I saw her third eyelids were kind of up, and she was just I think she was just such a super happy dog that we took her in. There's a lot to that as well. There's a lot of research on the bond between human and animal and the positivity, especially when they get cancer. You want to stay positive. You don't want to be sad around them. You can transfer a lot of that onto them. And I think that's really important. People don't realize that. I have that chat with all of my clients that have dogs or cats or anything with cancerous, metastatic cancers or any sort of terminal disease. Don't be too sad around them, because you really can transfer and make things worse. So,
Dr. Jyl, I'm going to stop you on that topic because I do think it's crazy important. It's the power of positive thinking and
yes.
audible speech. I actually took a deep dive in this in all of 2022. And I had some clients that had some near terminal horses and just animals really struggling for their lives. And I was like, do you think your animal's going to die? Yes, I do. I go, could you just flip the script? Can you just flip the script and start speaking life and positivity over them? And in 5 days, these animals were better than they'd been in 2 years. And that's the only thing we changed. So I'm a big, big believer in this. So thank you for bringing that
Yes,
up.
it's huge. And there have been documentations of it. There are writings and books. And another person who's very well equipped with that knowledge is Dr. Claudia Costa, the mistletoe vet. She's kind of enlightened me as well. It's really a dynamic to meet all these cool veterinarians that want to make animals' lives better, that want to go above and beyond just what regular Western the Western treatments, because it's not just about the Western treatments. It's a full body deal, right? It's environment, it's energy, it's food, it's herbs, it's just a whole thing. So there's no one magical thing for cancer. Okay. It's all about, and that's why in our clinic, there's no two animals that are ever treated the same. We assess the client first, because that's huge. It's nothing to think, you just referred somebody to me and that person actually has breast cancer. The lady has breast cancer. The dog has lymphoma. It ties in so often that we give each other back and forth the same energies. And so I think it's very important that you stay positive with your pets. And we see it all the time, right? The client is sick, the animal's sick. I always say, what you're walking on the end of the leash, that energy transfers to that animal. So you are responsible for keeping that animal positive.
I always wondered about that. I've seen a case where a guy had a throat cancer and then the dog got a throat cancer. And I didn't know if it was just because they're exposed to the same toxins and chemicals in the household, or if they're actually like absorbing it or something like that.
Yeah.
So I know you have an expert in the field that talks about that. I've reached out to her and I think we're booked for June to take a deeper dive on this platform.
Very cool.
On that, but it's a fascinating, and even Dr. Rob Silver talked about it too, is there's this symmetry type thing going on with our pets. And I guess I would assume it's only the pets that are really, really close to us. Like, I don't think cats manifest diseases quite as much as dogs, right?
Oh, you'd be surprised. Cats are a whole different level, right? They are extremely brilliant beings. I always think they're from another planet because they act like it, and maybe they are. But they're on a whole different level of dogs. They're just super intelligent, super dynamic, very they may act aloof or snobby, I guess a lot of people say, but that's just, I think some of that's their protective mechanism, right? That's a personality. So I think that, a lot of people are attached to their cats, right? More than dogs, and cats get cancer. I see a lot of kitty cats getting cancer. Unfortunately, it's more than I've ever seen, to be honest with you, the animals nowadays that are getting these weird, odd tumors and cancers. But like, just going back to what you said, like, you have a dog with throat cancer, the owner has throat cancer. I think there's transference, but I also think, like you said, there's something going on in that environment that may be creating that type of ailment. So you're going to get the same thing, right?
Right. I also had a client who a chicken got a lower limb cancer, their dog got a lower limb type of cancer. They all had tumors on the limb. And then she reached out her arm to me one day and I was like, what is on your arm? And
Oh,
she ended up having a cancer and manifesting in the lower limb. And so, yes, but they were definitely, they lived in a cancer cluster area that is not too far away from a nuclear site that was shut down years ago.
oh boy.
So, yeah,
There's something to that. And, that's another thing, environment. We always, when a cancer patient comes in, it's not just about the treatment, it's about how you live at home. We definitely go through and, I did house calls for years and years and years. And through COVID, I kind of stopped doing that. It was pretty difficult in California, all the sanitation and trying to get through all the protocol just to make a house call became a little more difficult. But I used to be able to go into people's homes and kind of assess things, right? Like, ooh, why do you have that there? Like you'd see all these Glade plugins or you'd see, toxic things around the house, the animals right at that level. And people don't even realize it. They're like, oh, we just like the smell. I'm like, well, your dog is like right there breathing in these toxic particles, or, your hair spraying and it's falling into the carpet, or, just all kinds of things. And so we like to evaluate people's lifestyle too when they come in. It's a total different experience for most people. They don't even realize it. They're like, oh my gosh, we're exposing our own selves to things that we didn't even realize our pet was exposed to. So when they come in, we do a full consult with that. We try to get the animals onto some type of a cancer diet, ketogenic diet. I try to wipe away all the preservative diets. I'm not a fan of the kibbles and things of that nature. We try to share that with clients and go into a little bit of that about how it's processed and how it off gases and all the toxicities from that. And we try to get people to home cook actually, or raw diets or whatever, depending on, because we always do Chinese medicine. So tongue and pulse diagnosis, personality diagnosis, what the animal needs, things of that nature. So it's full body. So going back, the dog's name was Deja Vu. She was such a cool dog and she just didn't look good one day. So listened to her heart, did a full physical on her, and she had a murmur that she never had before. I was like, what is this? So I thought, oh, it's probably boxer cardiomyopathy. That's another thing, is just when you think you know what things are, they like to throw you a curveball. So I called my friend who's a cardiologist and I said, hey, can you come, when you have a chance, can you come by and do an ultrasound on her, because this is a new development. I want to make sure it's not cardiac issues. So he came by and I was busy and he came in, he does calls to the clinic for my other patients, and super cool guy, super funny. And, I thought he was joking around. He's like, this isn't good. And I'm like, you're kidding, right? Stop joking around. He says, I wish I could say I'm joking around. Your dog has about 72 hours to live. I was like, what? You're like stunned, because she was about 7. She wasn't that old. And it turns out she had a pericardial sac tumor. And he said, I don't know how you found this. Most people find their animals dead on the ground at home. It happens after the fact. And so it's like very rare that we get to see these when the animal's alive. And so he says, you have 72 hours and she will probably tank. And I said, well, not on my watch, So, and this is before I had some of the modalities that I even have now. But what I did was I put on IV vitamin C right away, instantaneously.
I love that you have that, because nobody's really talked about that in this group of all the interviewers I've done. And I love the fact that you noticed the third eyelid was different. And what I recognize with pet parents is the more observant you are, the better success you're
Yes.
going to have.
Yes.
Everything means something.
Absolutely.
Or they could be manipulating you. Like, I wonder if my dog coughs just so I look at him, but I pay attention. I file it in my head and I like test it out just to see, is he drawing attention or is there something legitimate? So thank you for that.
Yeah, I think that's really important too. We teach pet owners to put their hands on their animals and feel, is there asymmetry? Is there something unusual? Is there a limp, or is there something out of alignment, or is there a weird odor? I mean, all those things are important. Does their stool look normal? Does their urine look normal? Are they squatting the right way? I mean, every animal that comes in, we actually take them outside of a long driveway and we walk them, and I watch them walk up and down, and see if there's any limps, any irregular gaits, any sort of atrophy anywhere, because I also do a lot of pain management. And I find that a lot of veterinarians, especially Western veterinarians, don't do that. They just put them on the exam table. And I'm like, well, how do you know where they're really limping? I mean,
I'm
it's
actually really impressed by that, Dr. Jill. I didn't know you did that, but the horse vets always do that, but
right.
I've never seen a dog vet like assess gaits outside like
It's
that.
very important. I mean, you can pick up cancers, you could pick up bone chips, cysts, all kinds of things, and sometimes even before it hits, right? And so I like to do that because I watch their head move. It's just like a horse. I think maybe it's because I did work on horses years ago. I don't work on them anymore, although now it seems like I'm starting back in again with you, Poppy. But I think it's important to assess your animal. Put your hands all over that animal, wherever it is. Look in their mouth, look under their tongue. That's a big one. A lot of cats get carcinomas under their tongue, and people don't see that. Oh, it's just bad breath and they have dental disease, and who wants to look in a cat's mouth, right? It's kind of a pain. But I find that if you don't open up, look at the tonsils. Are the tonsils enlarged? Are they discolored? I mean, all those things, and people can do that to their, I see more people that can do things to their nasty cats that come into the clinic than we can a lot of times. So, I always get these clients that are like, oh, I want to come in and hold my cat. And, they want to rip our face off. And they're like, oh, they're so nice to us, which most of the time they're not. But, have your client do a full physical and have them notice. That's a big one, is especially in cats, they get arthritis almost as much, if not more, than dogs. And people don't realize, oh, he jumps up on the chair fine. Well, take a look and see how many seconds it takes now for him to jump on the chair. Is he going back and forth like, okay, I got this, I got this, I got this, boom, you're up? Or is he just going up? These are all things. They can get cancers from that. And that could be something even intestinal or abdominal. It's just all these little symptoms that people miss. So yes, deja vu.
The subtle clues.
Yeah,
Yeah.
subtle clues. And
It
that's
all
really
means,
where we miss, a lot.
yeah,
So
it all means something. So back to the suspenseful.
So deja vu was put on IV vitamin C immediately. And what I like about IV vitamin C, all of our treatments are very gentle. We don't want our patients feeling crappy and miserable. There's a lot to radiation and chemo, and there's a place for that. And I think people have in their heads that the dogs and cats are reacting to the chemotherapy like people do. They don't always react that way. They don't always vomit and feel crappy and miserable. Most of the time, yeah, they may not feel so great. But I think people have a little bit of a jaded response to that. My feeling is I'm an integrative veterinarian. I'm going to do everything I could possibly think of to save your animal's life. And the biggest thing I get with holistic care is I don't want any Western medicine. I don't want any chemotherapy. I don't want any radiation, which brings me to a point of the modalities all work together. They're all friends, right? And so if you have the ability to treat something, like, for example, there's a new drug out specifically for canine lymphoma. My brother's dog has lymphoma now. So he's been great. He's let me do pretty much everything on this animal. We have them on the oral Laverdia. I also have them on a very small dose. And that's the one thing that I want to mention is a lot of veterinarians put these lymphoma dogs on huge doses of prednisone, huge. And to me, it's insanity because they feel like crap. They look like crap. They're eating, can I say crap? I guess I can. Sorry. Well, like it is. But they're peeing more, they're drinking more, their bellies get huge, they're panting. And so I've learned through Dr. Schallenberger, who's an amazing human doctor, is he does low dose chemotherapy. He actually does low dose on patients. And so just like CBD products, why are we going so high? It's the microdosing. Our bodies may not need as much as we think. And so I try to do an increasing dose versus a decreasing dose. I don't want to hammer them, right away. So I start out a little bit slower with some of these steroids. And if we can work it that they can stay on the lowest dose possible and maintain, the side effects are so much better. And so I think with like hypothermia, for example, that's one of the treatments we use. And I'll go back to deja vu in a minute. These modalities work beautifully with other modalities. So for example, hypothermia, people don't know what that is. It's basically
Yeah, and it's hyperthermia. It's not,
hyper, right?
yeah, it's not hypo, you guys. So nobody's talked about hyperthermia. I actually got to play with the machine not too long ago, and it's
Yeah.
pretty cool.
I think it's the wave of the future. I think that by those of us going out there and discovering these other modalities that humans are utilizing now, why can't we use them for animals? They're mammals. They get cancer just like everybody else. And so I was back during COVID, I was approached by a professor at Sac State, a biomedical engineer, to see if we could do some research on hyperthermia in animals. And had no idea what that was. And I thought, who is this guy? And he says, I want to bring a machine to you. Will you document for the next 6 weeks? Don't charge your clients, just document cases for us on what it does. And what it does do is it heats up the tumor to over 110 degrees, where it actually will cook the capsule of the tumor and make it more permeable to other therapies. So it drives other things like chemotherapy or vitamin C therapy or herbs into that tumor and makes it more permeable. And if you're interested in that, there's a hyperthermia center for humans in Salt Lake City, Utah. And I've actually talked to them. They thought, who's this doctor calling? Because their machines are like $4 million. I have one that's, like a couple $1,000. But I think it will be the wave of the future. And I keep pushing that because I've seen the results and they're amazing. And I'll talk about a couple cases with that. So simple, so gentle to the animal, which is really lovely. That's also one of our biggest issues is we don't want to hammer these animals. We want nothing negative. We want this to be a loving experience for them. Most of our patients aren't even put in cages. We have little tie outs on the wall. They get a little blanket with their food and water next to them. They sit with the IV pole, so they don't feel encumbered or they don't feel claustrophobic. So the IV vitamin C is also, all these modalities are used together in our clinics, and it's not expensive. I mean, the hyperthermia may run about $65 a treatment. It's done twice a week for the first several weeks, and then you can go to once a week. So at any rate, let me digress back to Deja Vu because I have another dog that we'll talk about hyperthermia with. So Deja Vu got IV vitamin C. She got ozone therapy, which, as you know, I'm pretty passionate about ozone. Rectal ozone. She got UVBI therapy, which is ultraviolet biophotonic therapy, where we actually take the blood from the animal, a small amount. We infuse it with ozone, straight ozone. Then we actually run it through a UV light machine, which actually helps kill off viruses, bacteria, inflammatory cells, cancer cells. And then we reinfuse it back into the animal. So basically it's just an IV catheter infusion. It's not like we're doing anything heavy duty. It's a blood draw and a catheter. And what that does is it actually acts like an autologous vaccination against their own disease. So it primes their antibodies to start fighting off the disease they have. Very simple. Is it cheap? Not really. It can run between $500 and $700. It's not horrible. I mean, it's certainly better than chemotherapy, radiation. And I have also worked with some of the Western oncologists to help. I have some clients that want to go to the Western and the holistic doctor. So, which is really cool because it's forced the Western doctors now to really think about some of this stuff. And so Deja Vu got rectal ozone, vitamin C. She was put on a ketogenic diet, lots of herbs, and we select the herbs accordingly, CBD, of course. And then, back then, and this is going back probably almost 8 or 9 years now, I talked to Dr. Margot Roman, who's like the ozone queen. And she says, Jyl, why don't you, because Deja Vu started filling up with some fluid around her pericardial sac, and it was really causing pressure and difficulty. And so she goes, why don't you take that fluid out of her and ozonate it and give it back to her? And I thought, wow, that's crazy. This is crazy. This lady's crazy, right? And Margot thinks outside the box, but I'm like, you know what have I got to lose? I mean, my dog is dying. she actually did very, very well for 9 months. I had her. She had a beautiful, extended life. We did all these treatments because she was kind of my test model with a pretty hardcore case too. And so I started doing that. I started draining the pericardial fluid off and actually injecting it under her, just a few cc's under her skin with ozone in it.
And that worked.
It worked. 9 months. The cardiologist could not believe his eyes. He was like, I have never in my life seen anything like this. This is craziness. And so it made me start thinking like outside the box even more. Like if this dog lived 9 months happily, and really the day she stopped eating was the day we put her down because she loved food. And so it got to a point where she was having trouble, with her heart. And I was doing I got pretty good at pericardial sticks, but we tried a lot of different things and she did very, very well.
So she was, her quality of life, she was basically a bouncy boxer till the very end.
Yeah, till the very end. And 9 months later of this, and it was a pretty significant sized tumor in there. It was causing pressure on her heart more than anything and fluid accumulation. But just incredible. Still played with the other dogs. And, there's a lot to be said for that. That really opened my eyes to a lot of other things about how we put this death sentence on cancer, and we shouldn't be doing that anymore. We have too many tools to be able to utilize. Cancer shouldn't be a death sentence anymore. And if you go outside and think outside the box, that's the way to go, because eventually it will become more mainstream in human medicine as well. The IV vitamin C, more and more people are thinking about it. Very inexpensive to do, really. I mean, even if it's $500, again, comparatively, you go into for chemo and radiation, they're going to quote you between 12 and 15 grand for that. And so the vitamin C is very gentle. Yeah, it's gentle. It's an IV. The first dose, the very first dose we give is half dose. We give them a little anti-diarrheal with it. We check their PCV. We still are doing our Western workups. Everybody should have their blood work and x-rays or ultrasounds. Nobody should just go into this blindly. It's important because a lot of people want to skip steps. And I think,
right. And some people don't find out what the actual cancer is.
Right.
So when I talk to my clients, I always tell them, well, you need to know, like every cancer behaves differently. You can't just go, oh, my dog has cancer.
Sometimes it's hard to find. I have a case now that I'm treating and we don't really know what it is. It's been seen by 3 veterinarians and it's in between the joints. We think it's a soft tissue chondrosarcoma, but I haven't gotten 100% verification on it. But, it's still going to be, I'm still treating that like a bone tumor. It's next to the bones. It looks like it's in the bones, and so a little bit is mindful thinking, right? Soft tissue versus bone. But I think it's important to try to find out as much as you can. It's very important to know, because the more you know, the more you can treat. Like if somebody doesn't get a diagnosis of lymphoma and there are other meds out there to utilize, then we're missing something, right? I think it's a good idea to understand what it is. But I've had several people come in with soft tissue sarcomas that have had biopsies, and biopsies aren't 100%, that just say sarcoma or soft tissue sarcoma. I'm going to treat that the same. I had a case where a little dog from the Bay Area was coming up. He was diagnosed with a soft tissue sarcoma, very fast growing up on his shoulder. And, they basically, the vets gave him a death sentence. So he was coming up, he went about 1.5 years, and I actually lost touch with him. He was still alive last time I had talked to him, but he was getting the UVBI, he was getting hyperthermia. He was getting IV vitamin C. And then what we started to do is actually through the years, I've learned that ozone has been amazing. You can utilize it in so many different ways. It doesn't just have to be through blood sources. You can inject tumors directly with it. And I've seen it with my own eyes. It's crazy how some of these tumors shrink or they become less active. But you can inject it. You can mix it with saline and inject it, like circling the dragon. You can just do direct air. Obviously we want it to be comfortable for the animal. So adjusting your gammas and things of that nature. You could do it rectally. You can, what we started to do is we do limb bagging, right? They actually have a bag that you can pump ozone into for like hooves or legs. This dog was small enough that we could actually put him in a limb bag, and we
Oh,
bagged
its whole body.
his whole
So
body. Yeah,
neck down.
neck down, because this thing was massive on him. And I was like, okay, I got to get on this. And it basically treated his whole system, right? I mean,
Well, that's what I was going to ask is you have cancer's not just the tumor, cancer's within the body, the tumor's
right,
the expression of the disease.
right,
So I love that idea that you limb bag because the skin's the largest organ.
right.
So it's absorbing it through the whole system. I kind of want to try that on myself, Dr. Jyl.
Yeah, I want to put you in a garbage bag and do it.
We should have a limb bagging party.
No. Well, they make ozone saunas, but they're really tough to get. They've been, I think the company that was making them got shut down, or they're kind of, and they're very expensive, but you can bag yourself. I mean, it's not like it's, as long as you're not breathing it in directly, or you put a destruct on it, you can certainly, they have ozone saunas that you can get into and ozonate your whole body. Your head, it looks like an egg actually, and your head sticks out. So they do have, things of that nature, or hyperbaric chambers. Some people use those, but I think the fact that, like you said, Poppy, I'm in agreement with you. When you see an expression of a tumor coming out, there may be plenty more inside that's going on that people don't realize, right? That's just it's like the fatty tumors. People go, oh, he's got a fatty tumor. What's going on inside? Why are these things
Exactly.
coming out?
Thank you for that.
Because
I'm
what's
always telling people this is a red flag. There's
right.
something off with your animal system. They're like, well, my vet says it's not a problem and all the dogs have them. I'm like, it's a problem.
No, it's a problem, definitely. So
Sue Williams asked, what do you think about pre-screening blood tests that they have for cancer, like Onco Canine? I don't know Onco Canine. Are you familiar with that?
I don't know Onco Canine, but I use VDI, and I do the TK1 testing. We love that one. And really quick, to not to divert, but I had a dog that came in, and I think it's very important to do that test because it'll show inflammation. It'll show a neoplasia index as well. And it's kind of hard to read still. The gentleman who invented it, Randy, is amazing. He runs the VDI lab. Always get a vitamin D test when you have a cancer patient, always. And I like to do B12 too, but usually those are included in the cancer panels, if at least through VDI. So very good idea to do that.
And what about like Embark or something like that, where you can run like the gene thing? Are you a big fan of that?
I think it's fabulous. I did it on my 2 boxers that I have because, as you know, boxers are cancer factories. So I wanted to check them. I was looking more for degenerative myelopathies and for cardiomyopathies, but they're fabulous. They do a whole bunch of different gene pool defects on breed specific pets. So that's another way, like find out ahead of time. I was so worried because, I had Diva who was a DM dog, and I've had several DM dogs, like degenerative myelopathy dogs. And so here I'm getting more boxers, and I was like, oh my God, I'm another one in a wheelchair, So, I mean, I had these gals tested. Thank God they're negative for that. Does it mean they can't get it? Yeah, but it's way less down on the totem pole of disease that they're not going to get that. So yes, absolutely. I think it's really important to find
And then
out.
also you're a really big fan of Glacier Peak.
I love it. Love Glacier Peak.
Me
Glacier
too.
Peak's a biofeedback test. It's a cheek swab and a hair sample that you send in. It's not expensive. I think we charge like $130 for it. And you get back so much information on what your pet is intolerant to, foods, environmental, allergens. I think there's like 90 different things on there that come back. And it will
I
tell
think
you.
it's 300 actually. I think Dr. Jean Dodds is 90 and
Oh, genes is more. Genes is more. Yeah, the Nutrijest test is more. It's another great test though, but hers is definitely more expensive. The Glacier Peak, you can buy it online and do it yourself and send it in. That's the one I think we did on Harley. But
yeah, I've done it a couple times. Nina's asking, can those tests be done at any age? Is there a best age to do those tests for cancer, the onco test?
well, the onco test, any age at all. Have your veterinarian draw the blood, they send it out. You'll get the results probably in about a week or so. But yeah, that's another one with different markers that shows you cancer.
So those tests are actually in-house the Glacier Peak you can do in-house with your veterinarian, or you can actually just order it online.
Right.
If ARC, you can order online. There's lots of home testing now, which is kind of fun.
Yeah, it's really cool, actually. The other thing that I find people want to decline on, and I think it's really important, is do a fecal sample. When your pet has cancer, the last thing you need is a concurrent infection of parasites. And I've seen that over and over again. That's what I was going to say is about the testing is I had a dog that came to me. It was owned by an pediatric orthopedic surgeon. Okay. Pretty bright lady. The dog was getting thinner and thinner. It was diagnosed with lymphoma, no biopsy, no blood work. But the previous vet said, oh, she's losing weight. Her lymph nodes are a little bit enlarged. It's lymphoma. They came to me for a second opinion. We did full blood work, x-rays, ultrasound, sent the blood work in. Guess what the dog had?
Oh my gosh.
Giardia.
Parasites.
Giardia.
Giardia, that was it? And
that was it. Put the dog on Giardia medication, lived like 6 more years, no problem. It died of old age and arthritis.
oh my gosh.
Total
I
misdiagnosis.
actually had a similar experience with a corgi that I owned. And so it was, they thought it was cancer and it was Cushing's. So
Yes.
yes.
So
And
be mindful of those little things, get a second opinion. If your veterinarian's butthurt about that, too bad. You know what I mean? It's like, I don't mind if somebody wants, because we all veterinarians have different backgrounds, different experiences. We've all gone to different schools. We've seen different cases, and you remember those cases, right? I mean, I have now seen, unfortunately, 2 pericardial tumors in boxers. Okay. And that's where I was going to bring up this little adorable boxer, not mine. It was a client's. Same thing happened where little Miss Holly was her name, and she was adorable, and she was always super, playful. And dad brought her in one day and said, she's just not acting right. And I listened to her heart and I was like, ooh, that sounds really bad. So x-rays, the whole thing. Turns out she had a tumor inside of her heart. And I was like, oh, I know how to treat this now. Like, it was familiar. But what I had was, and she was one of my case studies for the hyperthermia machine. It was all timing. So she was really one of my first patients with the hyperthermia, and we put it right over her heart. Again, maybe a 3-week window of survival. Little Miss Holly lived about 6 months, happily died in her sleep at home, curled up in her bed. The owner came home one day and she was done, but she came in for all the treatments. She got hyperthermia for free. And actually all of our data was published. There was a student doing a master's in hyperthermia medicine. So all of our data has been published from our study, which is really cool.
that
Because,
is cool. I would love to see that and share this in the group.
yeah, I'll see if I can, Dr. Preetham, the gentleman who's going to be talking at our ozone therapy seminar, I'll see if I can ask him to get those results for you, because he's the man behind the hyperthermia. And I had no idea what that was even about until I met him, and it just the planets aligned, and I just love it. It's such a nice, gentle treatment, and the animals love it. My techs love it because they get to sit for 20 minutes, holding an animal under a nice warm lamp and resting. So
Right. I actually put my face under it and it was subtly warm and tingly.
yeah.
I was really surprised how lovely it was. Actually, I'd do it again for sure.
Yeah. So
Yeah.
it's not painful at all. And it's, again, it's fairly inexpensive. So I like to do that with like my vitamin C therapy or my ozone therapy, because it just permeates those tumors. And say you have something like lymphoma, what I do is I put it in a central location on their body. I usually position it over their abdominal or liver area. So that way you're treating, because it's the lymphatic system, right? You've got all these crazy lymph nodes. Usually what happens when I do treatments like that, and it happened with my brother's dog a few weeks ago, it was crazy. He had a giant lymph node and it was like half the size the next day. It's crazy. You never see that. And so just by doing all these modalities now, I'm seeing the difference. I'm seeing a longer life. I'm seeing a more quality life. And people are happy about that, and when they're ready to go, they're ready to go, but at least they have a chance to survive some of these things, or at least to have a better, longer time with your pet.
Is there any other unusual cancer cases you want to share with us today?
I think there's some definite things like neoplasm. That's something
Oh,
that,
yeah.
highly gets missed. Mistletoe, another one that Dr. Claudia Costa, amazing person. I'm trying to get her. She's in Brazil. She teaches a class to veterinarians in Portuguese. I'm trying to gather enough veterinarians up for her to make it worth her while that she can teach it in English, because that is an amazing modality. And I've seen that work over and over. If you go on Facebook, there are human Facebook groups of mistletoe survivors, breast cancer survivors. And
Yeah.
so we're starting to get more and more people interested in that, which is really cool. It's just injections. It's not like,
Right.
like we're hammering the crap out of these animals with, is it comfortable? No, they do spike a fever, but we want that fever. That's a good sign. It cooks the tumor, right? That's exactly what we're looking for. And some of these animals have gone on and on and on. Dr. Costa's really the guru in that. She's just written a book, and I like to spread the word about things like that. I think veterinarians need to have these tools at their fingertips so we can make our pets' lives better, the owners' lives better. It's so full circle, right? I mean, it's not just about the pet, it's about your family and their family members here in this country. We look at them totally different now, which is great. I love that. And so the more we can learn, the more we can add, the better off we're all going to be.
That's awesome. Talk a little more about neoplasm. Nobody's really talked about that either. That's just bloodroot, or is it a bloodroot mix?
It is a blood root. It can be a mix. It can be very graphic depending on how you use it, but they're making it in a capsule form now. So more and more people are utilizing it. I have a very, very, very dear friend who had squamous cell carcinoma on his face, inoperable. They reconstructed his teeth, and I mean, it was very distorting. And I was like, they gave him like 3 weeks to live. And I said, dude, you got to look at neoplasm. And he's like, what's that? I said, you do not, nobody needs to know that I told you about it. I'm a veterinarian. I don't want to get in trouble. He sought it out. He put it on the tumor. About 6 weeks later, the tumor literally fell out into a napkin when he was on a cruise ship.
Wow.
Crazy. And it's very graphic and it's painful. Okay. I will tell you that. But we're learning to utilize it a little bit differently now. We're diluting it, using it a little less stronger. It takes a little longer, but I have seen it attack tumors like nobody's business. It's crazy.
Now, are you using it external or internal or both?
You can use it both. You can use it on external tumors. But again, it's something that the client has got to be ready to do.
For a little uncomfortable.
Yeah, it's uncomfortable. It definitely is. But people are using it orally now too. It comes in capsules, things of that nature.
I actually used to carry bloodroot in my practice, and I would just grate the sticks. So I would just buy whole sticks. Literally the inside of the sticks are red, and that's why it's called bloodroot. It looks like the plant's bleeding when you harvest it.
Right.
And so I would just grate a little bit and eat a little bit myself. Now, if you can have a really extreme reaction, or you could have nothing happen. And so you eat just like a shaving of it and let it like sit in your mouth for a while, and you can feel it attack or treat parts of your body. It's like a heat-seeking missile.
Yeah.
And you could take it for a little while, but then if it makes you nauseous, you probably had enough. Like you could get pretty sick on that.
I often think that when it works like that, that you've got some sort of a neoplastic cell in your body, because it will not react like that. If you put it on a non-cancerous growth, it's just going to sit there. It's not going to do anything. But if you put it on a growth that has cancer, it'll attack it. I mean, it'll just hammer on it. So it's interesting that you say that, because I think maybe there's some component to that where it's fighting off precancerous cells in your body by doing that. Neoplasm is a really interesting, it's kind of a, it's been so taboo for so long. The gentleman who really brought it to light was Dr. Fox. He's passed away. Buck Mountain Botanicals used to sell it, and it was fantastic stuff. And so
with his own concoction.
It was his own concoction. The company is kind of, I don't really know. It's very hard to get hold of them. I've tried several times, but now you can get it like my friend actually got some on Etsy. I think somebody was growing it and it's somebody reputable. I mean, you do have to be careful where you're getting things like that, but
I was just getting it off Star West website.
okay. Star
Yeah,
West.
the Star West was selling it. I don't know if they still sell it. I should probably get some.
Yeah, it's
And
great.
Nina's saying, wow, would that work for a EPUL? What is that? EPU, EPULIS?
Oh, an epulus in the mouth.
Epulus,
Epulus.
sorry.
If it's cancerous, yes. And I have worked with some oral mouth tumors. It gets extremely graphic. I did have a dog that some of my clients kind of push and push and push, and you get to the point where I never want to tell somebody to euthanize their animal. That is not my place. But when you see an animal suffering and it becomes your entire staff is stressed over seeing this day, week after week, day after day, it gets to a point where like, okay, we need to say something gently to somebody like, do you realize that your animal is uncomfortable, that nothing is working at this point? And I did have a dog that had a very aggressive oral mouth tumor. We did use it on, and it literally ate away its cheek, the skin on its cheek. So you could see inside the mouth. I mean, it was a very aggressive tumor. And she was like, can't you suture it up? I'm like, no, you can't do that. This is necrotic tissue that's, dog's face is hanging down. And most people would say, oh, that's cruel. And it did get to a point where I was like, no more, we can't do this anymore. This is about, I also made a commitment not to make animals suffer. And she was really angry with me. She went to another vet who I guess he called me, he's like, you have any neoplasm? I was the same, one of my colleagues. I'm like, if you want to treat that and you think that that's being kind, that's on you now. But I feel like this is above and beyond making this animal suffer. And so, it can get very, very, very graphic, really terribly. The other thing that I want to mention is please do not vaccinate animals that have cancer. Please.
Thank you. Thank you. Oh my gosh. I
It's
appreciate that.
crazy. People go in and their dogs have lymphoma and they go get a rabies shot. I'm like, why? If you're that worried, get a titer, right? A titer test. I don't know if people know what those are. It's just an antibody test, a blood test to see if your animal even needs the vaccine. I think those should be done anyway every year. We just hammer them with these vaccines. Why are they getting cancer? What vaccines are we using? Really important. Ask your veterinarian, what brand are you using? Why are you so much cheaper than this guy down the street? I use my rabies vaccines for cats, which I always they're $900 a tray for 50 doses. $900 they cost me, but they are the ones that are non-sarcoma forming. They last for 3 years.
Oh, like there's literally a sarcoma inducing vaccine.
Non-sarcoma.
But you're saying the other ones could be.
Of course. Absolutely.
Dr. Jyl, I had no idea.
Yeah, look into the bottle and see, is it thermosol free? Is it got antibiotics in it? Some of these vaccines are being preserved with antibiotics. I hope I don't get killed for saying this. I mean, be careful. But
you've got a lot of barking dogs. I think you're fine.
I mean, you've got gentamicin being added into as a preservative for some of these vaccines. Well, what is that? That's an antibiotic. People don't even realize. And maybe it's a minuscule amount, but it's still going into your animal system. So, I mean, all these things add up. You definitely need to be careful if you have a cancer patient. I had a cancer patient that had another melanoma in the mouth, very graphic, treating it, doing great. This dog was amazing, doing fantastic. What happens? They get a card in the mail from their veterinarian. Oh, your dog is due for a Bordetella vaccine. What do they do? And there's a big tumor on the side of its mouth underneath. They go to grab the dog's face to give it a Bordetella vaccine. They squeeze that area. A week later, the dog comes in. It's literally like hanging. The skin is hanging off. I could see all of its teeth. Another fun one. And I was like, what? How is this happening? We're doing so well. And I said, is there anything different? Is there any, I'm going through the history with them. They're like, well, we got this card in the mail. And I was like, oh my God. They gave the dog a Bordetella vaccine. It reacted, right? Why would you do that? It's crazy. So
That's
be mindful.
so scary. I have a friend who's a Frenchie breeder, and some of his puppies got sick, and the vet vaccinated him.
Ugh.
because they thought it would build immunity. And I was like, you don't vaccinate sick animals.
No. No, and there's some really cool stuff out there now that you can give your animals if you're going to get vaccines. I'm trying to think of the name of the company. I love it. I send it home with all my puppies. It's oh my gosh, it's the people that make the transfer factor. Katie's sells it, Katie's Pet Products. It's
Well,
another
and
chewable.
do you use transfer factor?
I do. Yeah, I use it in pretty much all of my cancer patients. I use it in concurrence with canine immunity because they're synergistic. So canine immunity, the professional canine immunity has a lot of herbs, but it also has a lot of mushrooms. Mushrooms are excellent for cancer. I'm sure you've had people on talking about that. Obviously, it's a big topic. Again, these are all like, it's so interesting, all these different modalities that we're using for cancer now. And I'm a firm believer, like some people go, I just want one thing because I want to see if it's going to work. We don't have time sometimes for that.
Right,
You know?
exactly. You have to kind of like weigh your odds at that time pain ratio and the tumor growth. And
Yep.
there's so many factors to just
So many factors.
incorporate, and then people's finances and
Yeah.
what they're capable of handling. But transfer factor's been around for years. I kind of forgot about it. They had it in the horse space too. And that's
Yes.
kind of a colostrum based product.
Yes, it's excellent. It's an excellent product. It's escaping my brain, the name of the company. Oh my gosh, I can't
I
believe it.
can't remember it either.
But it's an excellent product. I like the canine immunity, or the eye tabs is another good one. You know, some people want to do individual herbs. I know you customize herbs. I don't
Yes.
really have a whole lot of time to be doing that. So I find product that I really feel works beautifully through some of these reputable companies.
Yeah, and
And
I really preach, try to find one thing that does a lot of good,
right.
not a lot of things that do a single thing
Right.
good.
That's why I like those combo, because there's probably about 50 different things in the canine immunity, mushroom and herbals and homeopathic and all kinds of cool things within that powder. It's expensive, but you're not buying a bunch of different things. It's one thing mixed with maybe transfer factor. CBD is also excellent. That's obviously a great anti-neoplastic medication, helps with appetite, helps with
Pain management,
pain management,
inflammation,
well-being, things of that nature. So I think that's also should be a requirement for cancer patients.
but you can't sell that in your practice.
Not supposed to. I believe we can sell topicals. The FDA doesn't really look at topicals as a problem, but most people know where to find it now. They go out and get it, and you just want somebody reputable. But there's a ton of pet products out there now.
Right.
And it's changing. Hopefully we'll be able to make recommendations.
Yeah, absolutely. That would be great because I think it's safer that way.
Right. I know that's another thing. It's like, we're the healthcare professionals. We should be the ones recommending it, not just letting somebody off the street go, oh, I'm going to get X, Y, and Z. And somebody behind the counter at a pharmacy who doesn't have any experience and they're giving the wrong thing out. I mean, we should have training in that. We are the healthcare professional, and it should be regulated that way so that our patients are safe from it.
Absolutely.
Seizure patients or whatever it is, they should have a guideline by a healthcare professional instead of just having anybody off the street make butter or whatever it is and just slapping it to their dog. You need to be really careful about stuff like that.
Yeah, I agree. It's super sketch. Carmen's asking, what can you do for a tumor mass on a spleen with no surgery?
Union Bio, excellent.
Yeah, I was gonna say that. We haven't really talked about Union Bio. It doesn't. So do you think it helps the cancer or just keeps it from rupturing?
Keeps it from rupturing.
Yeah.
And I do like, actually, Standard Process makes a product called Spleen or Spleen PMG, because, in Chinese medicine, we believe that you feed what you're deficient in or what you're having a problem with. So diet is huge. I've had some hemangio cases last over a year and a half just on Union Bio and herbs. It's crazy. Vitamin C is great. If you don't want to get it, some people don't want to get the tumor out, or they say it's inoperable. But Union Bio by far has been one of the best things. If you can't afford to do anything else, that has been by far one of the best things you can do for the pet. Absolutely.
Right. But you don't want to use it as a preventative because it won't prevent
Right.
cancer. You're just looking at it as a anti-rupture, bleed
Right.
out type
It,
situation.
it does have other properties in it, but you want to combine that with herbs, there's some great Chinese herbs for hemangiosarcomas as well. But you need to look again at what the animal's eating, what's the environment, how active they are. All those things come into play, their age, things of that
And
nature.
would you use the ozone on that?
Absolutely. You bet I would use ozone. And again, if you can't afford to do all the heavy duty treatments, rectal ozone, fabulous for that. Some of those machines are maybe $700 or $800, and you could treat your pet at home every single day with it. Not invasive, not harmful. It's a small little catheter, goes in rectally with olive oil. You can infuse ozone right into their system. And I've had, everything's so different. Like you were saying, you have to look at the dynamic of the family, their finances, the animal's ability to accept things, what kind of cancer it is. Veterinarians have a lot of pressure on them because we have to really think about how to make the best choices for the situation the animal's in. And sometimes it's stressful to us. We see things that we can fix and people are like, no, I don't want to do that. And you're like, oh, serious, I could really help you. And you're like, you want to say that to them, but you have to be mindful and sensitive to that. And so some veterinarians carry that around, which you really shouldn't. But compassion fatigue is a huge thing, especially with, cancer cases. So it's important to look at all of your options. I would say hyperthermia would be fine for a case like that.
I was just going to ask you that. I bet hyperthermia would be super cool for that, but you're the only vet I know that has a hyperthermia machine.
Well, you can, if you can search out SanaWave. SanaWave is another device that has high frequency PEMF, and I think it's some sort of a thermal device. Hard to find, expensive treatment along the same lines. But that's why I want to get the hyperthermia out there. I really want to start getting people to look into that. There is, like I said, there's a huge center in Salt Lake City that and they actually use probes in people. They actually go into the tumor itself and heat it up.
Oh,
It's
you're kidding
cool.
me.
No, it's really cool. They're using nanoparticles. I mean, there's all kinds of things going on now. So we have resources. Cancer should not be the reason that people or animals die anymore. It should be from old age or something else. And that's typically what happens with a lot of my patients. They don't die from cancer. They die from something totally unrelated, old age, or like I said.
And I don't even think old age is a disease. Like I have a little beef with being called old. I just hate that. I hate that. I always tell people, don't call my dog old. Don't call me old. I don't believe it. I believe that degradation is from lifestyle or trauma or stress or
absolutely
some sort of pathogenic thing. I mean, there's plenty of young, old people out there now.
I'm one of them.
Yeah, we are not our parents' seniors.
Right. No, and it's very true. It's a lot of it's in mind, body, and spirit. It's what you make of it. I often say, I feel like I'm 25 inside again. And the girls that I work with are all younger. They're like, you're so like, we don't even think of you as you're in your 60s. I mean, I'm in my 60s. Okay. But you have to take care of yourself. You have to have a positive mindset. No matter how much crap happens to you, everybody has crap that happens to them. You got to pick your bootstraps up and move on. And I think a lot of the problem too with some of these younger generations is they have anxiety. They don't know how to cope. Their coping skills are very muted. And I think it's important that could preset them for some of these diseases that we're seeing. So we need to circumvent and really rethink, like teaching people to be thankful for what they have. Yes, there's a lot of crap that surrounds you, but that also plays into cancer, right? It also plays into what you're building in your immune system. Really important.
Absolutely. It's like that glass is full or the glass is half empty type attitude. So Sue's asking about brain tumors. What do you do about brain tumors?
So there are some herbs, very specific herbs for brain tumors. There's one called Stasis of the Mansion of the Mind. It's by Jin Tang. I utilize that one mostly for brain and nasal tumors, any kind of head tumors. There's also mistletoe specific for head tumors. Hyperthermia, no problem at all. If the dog is having seizures, then we put them on. There's certain herbs for those particular type of seizures because it may be space occupying, right? In people, a lot of times these tumors are more space occupying. They're not malignant, so they're causing pressure. Do some people go get brain surgery for their animals? I'm sure they do, but what's the likelihood? A lot of people don't want to go through that. But again, IV vitamin C, proper diet, utilizing herbs that may be diuretics to shrink things a little bit or drain the fluid off up in the brain area. That some of those herbs are excellent. I've had quite a few nasal tumor animals go a long time just on some of those herbs alone. I love stasis dementia of the mind. It's really been a good one for me, and seeing success with that. I think it's a really nice, along with some of the other herbs. Again, depends on what your veterinarian finds. Chinese herbal examination, Western examination, all those things come into play.
What about DMG
DMG is great.
for
DMG,
brain issues?
yeah, absolutely. And acupuncture. I was going to mention acupuncture, ozone acupuncture, really great for brain tumors, by the way. I have my little Frenchie dog that I have I think she has a tumor behind her eye. And so we've been infiltrating her shrunken head muscles, which also you can blow them back up really nicely using ozone or aeropuncture, they call it. You can infiltrate ozone into those areas. The ozone goes where it wants to go. It
also like is heat seeking. So I
Yes.
noticed I had this like infection on my foot and I limb bagged it and it turned that infection kind of black and like peeled it off. But the rest of my tissue was absolutely normal. I was so
Yes.
fascinated by that. So it does that in the body too.
It does, absolutely. The ozone's great. It's super oxygenation. So if you could find a veterinarian that feels comfortable doing ozone acupuncture or just even ozone injections right in the temporal frontal area, or even behind, even small little bits, because we do ozone in joint areas. I do prolozone, which is an injection into joints to stop pain for like cruciate tears and things of that nature. But I've kind of backed off from that because it's very painful. You have to sedate the animal. And I have found that if I go around the joint properly, the ozone goes where it wants to. It really finds its way to the inflammatory process in the body. And it's just
So cool.
it. Yeah, it is.
Dr. Jyl, I wish I knew you earlier. I wish I knew you with my last bulldog. Oh my gosh. I'm like getting a little teary-eyed hearing all this. Oh, so
Well, it's time, there's essential oils, right? I know you had there's so many things at our fingertips now that we can use together, right?
yeah.
I have people, I make up little concoctions of essential oils. I'm nowhere an expert like the doctor that you have on.
Dr. Janet.
Yes, yes.
Dr. Janet's
But
amazing.
there's specific essential oils that you can buy that are for cancer, right? Like frankincense or copahiba. And what I tell people to do is get some fractionated coconut oil, mix those in a syringe, and you can actually give them rectally. So it goes right into the system. Some people give them oral or topical. I have people freeze them so they can utilize them. Some people freeze ozone oil and do that and go right in the tushy.
I also do colloidal silver.
Yes, colloidal silver and DMG you mentioned as well. Colloidal silver I like for the bacterial components more than anything, because some of these cancers do have a bacterial component, and it's a nice cleanser.
I had a client's dog with some lymphoma, had little swollen glands right there, and we just sprayed colloidal silver in her mouth daily, and it went away.
Awesome.
And when they quit doing it, unfortunately, it came back.
Yeah.
And so it's something you have to stay on top of.
And you can mix that. That's one of my favorite things. I take colloidal silver. I like the Glacier Peak colloidal silver. I take that and I mix it with Dr. Melissa Sheldon's dog breath.
Oh,
oil.
cool.
And we put 10 drops in that, and we actually sell it that way because it's great for keeping dental disease down as well, right? It keeps the mouth clean, which is really nice. But you could put frankincense in it, or you could do a mixture and spray it in your pet's mouth for cancer as well. That's another way to deliver some of those oils. That's a little bit nicer than going in the tushy, I guess.
So hold on, Sue, I wanted to just drag home the DMG component. If your dog is having seizures with a brain cancer type thing, a brain tumor, it might not, I don't know if it's cancerous or not cancerous, but it's causing your dog some harm. But DMG really helps seizures.
It's excellent. if you're looking for natural seizure medication, Tang is a good one. There's a couple of them, and I'm just going to escape my brain. There's another really good one from Tang for seizures. If you find a holistic veterinarian, acupuncture is excellent for seizures. Absolutely off the hook, great for seizures. Some people put gold bars in, or gold,
Gold
wire,
beads,
gold
yeah.
beads, that's
I'm
another.
so glad you brought that up. All those metals in homeopathy, it's so interesting because gold, silver, platinum are all used for monetary value, right?
Right.
And so it's called currency, but it creates a current too. And so in homeopathy, all those remedies work on the nervous system really well because it creates the current through the
Excellent.
body. It's so cool how it's all entwined.
I mean, I suppose you could put a gold collar around the dog, that's why not? If it's not going to hurt to put a gold, uh,
Chain or
necklace or something, or chain around the animal,
yeah,
right?
and I've played with copper too. So
Copper's
all those things have healing components, but you don't want to use them 24/7 either. Like copper
right.
is a toxicity on a micro level, so you put it on and you take it off. Often your animals, I used to make these copper rings for horses' hooves, and it would grow their hooves out really fast, but it would take away lameness really fast,
Yeah,
and it increases bone density, but it's a trace mineral, so you can't leave it on very long.
right.
Yeah.
Same with crystals. I mean, there's many different crystals for many different things, right? It's all energy,
Do
depending
you
on.
use crystals in your practice?
I do a little bit. Yeah. I used to have somebody that would come in and do Reiki and crystal therapy. She doesn't come in anymore. So I've done some Reiki. I think that's also really important. Again, have some body work done on your animals, especially if they have cancers. Or even if they don't. I mean, it's great. But yeah, we do use crystals. I don't know if you've seen them kind of hidden around the clinic. They're they're kind of,
No,
I
I
mean,
never
they're
saw that.
stashed around, but yeah, I mean, people used to go, oh, crazy hippie Dr. Jyl kind of person, but now it's like, hey, there's something to this. They're finally holistic medicine is making it out of the dark and into the light, and more people are interested in it. More and more people want to know about it.
I really think that the old ways are the new ways. So
Yes.
I think it was such common information back in, the BC to AD early era that nobody wrote about it because everybody knew about it. So it was just handed down verbally. And then all of a sudden, with the modern medicine, the creation of antibiotics and vaccines and things like that, all that stuff went to the wayside. But the people who were living off the land, the homesteaders, they weren't getting cancer like everybody else, and they weren't getting the Black Plague, or they weren't getting smallpox. So because of the cowpox, those milkmaids were immuning themselves, and none of them got smallpox. So that's where actually vaccines came from. I love this story. Is vaccines is baka, so meaning cow.
Right.
And it came from the study of cowpox versus smallpox, or yes, cowpox and smallpox. So they noticed that all the cattle people were not getting smallpox because they had exposed themselves to cowpox. And that was the start of vaccines and homeopathy.
Yes. Kind of like, stem cell, right? Stem cell is also another interesting modality for cancer. It's expensive, and I think the cost will go down there. Some of these stem cell companies are actually having you send in your tumor, and they're making a vaccine against the animal's tumor, a personalized vaccine to give to that animal. They send it back to the clinic.
Have you had that work well? I've seen a client use it on a horse and it didn't work.
I have not used it myself. I
Okay.
use so many other modalities in my practice that work for me. And I really try hard to keep the cost down. It gets very expensive. Things add up quickly. And, people are, oh, the vet's so expensive. It's like, if you knew how many different things we have to shell out for, it's really sad because the prices have gone up everywhere. I mean,
Well, and I'm literally, you guys, I'm literally in her surgery room today because my Wi-Fi crashed And I'm surrounded by equipment, like, and Dr. Jill's a solo veterinarian. She works out of her own practice by her home, and she has her own vet tech. She has not sold out to VCA or Banfield or anything else. She shows up every day. Well, not every day, but you are on all the time. Like, you never quit. And then you created this Ozone company now,
Right.
which is insane that you took and put it on top of you, but you saw a desperate need because you couldn't get your ozone machine fixed, and you needed that because you use it every single day in your practice. And
Yeah.
so you got mad and created your own ozone
It's just
company.
like the ability of Ozone. I've seen so many incredible things with my own eyes. I couldn't let it go. It kept eating at me. I'm like, people have to know about this. Veterinarians need to know about ozone. We need this in our practices. This is so ridiculous. It's so simple. It's just oxygenation and disinfection. And, people use it in their water systems to disinfect. It's standard of care in Europe. It's very prevalent in dentistry, even in South Africa. I've had people reach out to me in South Africa asking me, like, why aren't we using this in our dental practices here? And there are several ozone dentists, but it can hammer on a cavity like nobody's business. You may not have to have that tooth pulled. It gets into the gum line and kills the bacteria causing that disease, right? It's
Yeah.
it's so cool. I was like, I have to do something. It was just irking at me. And I think the next thing that I want to do, I have so much energy, it's ridiculous, is the hyperthermia. I'm really excited about that. I love these gentle therapies that don't cost a lot of money, that help, that actually are part of the process. The Ozone company is new. We're going to have a training. We're going to try to train some veterinarians, some veterinary technicians. We're expanding it to the equine market. That's how Poppy is involved. Michelle, my expert in equine ozone therapy, is going to be there. It's phenomenal. I mean, I can't say enough good about it. I've redesigned a lot of the equipment to accommodate other animals, especially the equine market. And so I think it's the wave of the future. It's actually here, right? And I will do everything
now.
The future is
Absolutely.
now.
So what's your website? Regenazone. It's a little tricky.
It's Regenazone Vet, but with a 3, right? So REGENO 3 ONE VET. Yep, .com. Regenazonevet.com.
Hopefully
And
that comes up.
if anybody is interested in any of the modalities that I do, you can go. I have a website, just drjyl.com. It's drjyl.com. If you go into our services and pull down the drop down menu, you'll be able to read about all these services that we provide. And also AHVMA has many veterinarians listed for some of these modalities. If you're not in my area, we're constantly referring to that website so that people can find veterinarians who do ozone therapy, essential oil therapy, Santa-Wave, whatever it is that you're looking for. I find IV vitamin C is very popular, and I now have written a protocol for that. I think it's like $99. We sell the protocol now because I have had so many people call. And it's on the Regenazone website. You can actually buy it right off of there. It gives a history. It's probably about a 6 or 7 page paper with actually exactly where to purchase it, what websites to go to with references. We want to make sure people understand it, but it is really a lovely modality to add in, not just for cancer either. It's great for arthritis, Lyme disease, some of your more autoimmune diseases. You do need to be careful. We always do a hematocrit or a packed cell volume prior to make sure the animal's not anemic. But we want to make sure that people know how to do it correctly and don't just dump a bunch of vitamin C into an animal, because there can be ramifications.
Yeah.
All these things.
Yeah, like you said, the iron. So I actually was hemochromatosis, and they gave me IV vitamin C. And in the first minute, I was like, pull it out now. It was burning my veins. It was so painful. And they were a little rude about it. None of us knew that I had hemochromatosis at the time. And
Yes.
they're like, oh, come on, it's just a little sting. I'm like, no, I have a high tolerance of pain and this is unbearable.
And that is actually one of the diseases that is contraindicated in vitamin C, believe it or not, hemochromatosis. So yes, you definitely need to check your pack cell volumes before, make sure the animal's not anemic. And then, that animal doesn't get that. You can go on to ozone therapy. Ozone therapy is okay. Another modality though, that you want to check and make sure your animal's okay, their blood work's fine. Because if they're super anemic, the last thing you want to do is dump fluids into them and make them more anemic, right? You have to be responsible about some of these things, or you use rectal ozone instead of intravenous. I mean, there's so many ways to use ozone. It's crazy. It's not just rectal or intravenous. You could do acupuncture, you could put it into joints, limb bagging. There's major and minor autohemotherapy. There's subcutaneous fluids that we actually put the ozone into now, and it floods the animal and delivers the ozone gently through the whole system, which
That's
is
cool.
so there's neat ways of doing it. You can actually infuse it, but you have to be careful. It needs to go through oil because it can be toxic. In the ears, obviously, we've done that with your dog a lot. There's a really great treatment for ears, and even for polyps or ear tumors. It's a really great way to get some of those things to kind of come down. There's a little stethoscope we put right in the pet's ears, and people can do that at home too. That's a really easy modality to do at home as well.
So you also have a data bank on your website, on your Regena Zone website, that lists all the veterinarians that use ozone therapy. So if you guys want to take advantage of ozone therapy, but you're not in Folsom, California, then hop on that website and see if there's somebody local to you or in a decent driving range.
And if you know of somebody who's not on that website, because we're trying desperately to collect as many people as possible, if you know a veterinarian that's doing ozone therapy, please email us and let us know. We will add them immediately. In fact, I wasn't on there.
They forgot you.
They forgot me. My web designer's like, I think I need to be fired. I'm like, it's okay. Yeah, they forgot me. So I was like, where am I on there? But yeah, if you know of somebody doing that modality, that would be excellent to add it. So we have that as a data bank. So that way people can find ozone therapy.
That'd be great.
Yeah.
All right, Dr. Jyl, thank you for your time. We learned so much today. I hope you guys enjoyed it and are encouraged by today's share. So many new things to consider, which is really exciting. You've been awesome. Thank you for your time.
Thanks, Poppy. I appreciate it.
Thank you for your office, your surgery room. There's all the ozone, you guys, right there. So I'm in her ozone room. It's a Take care and have a great weekend, you guys. It's Friday.
Thanks, Poppy.
Bye.